Hello, you're with www.indiapostlive.com, India's first live conversation web television. Well, all of us crave those yummy, juicy burgers, those enticing looking pizzas, and of course our very own desi fast foods, the samosas, the aloo tikkis. I could go on, but I'm sure all your mouths are already watering. But are you aware of what these foods are actually doing to your body with all those calories and the free sugar? They are called junk food for a reason. Now, are we actually becoming more and more unhealthy, more and more obese? Are we unhealthy as people because of the manner in which we are consuming fast foods? That is going to be the conversation today on indiapostlive.com. First, let's take a look at this audiovisual.
Obesity is a growing concern in India, with 1 in 3 Indians in urban India classified as overweight. While fast food is not the only reason behind rising obesity, it is of course one of the major reasons.
I guess children spending more time playing PlayStation, Xbox is a bigger factor because now people don't actually go out and play.
They are applying that mayonnaise and all the things. Okay, so everybody knows that they are not fat-free.
A recent study conducted by the Center for Science and Environment on junk food and nutrition has disclosed that these foods contain very high levels of trans fats, salts and sugar, which can lead to obesity-related diseases such as high blood pressure, diabetes, heart disease, high cholesterol levels, cancer, infertility, back pain, skin infections, ulcers, gallstones and so on. So, is India on the verge of a giant epidemic?
All right, so are we becoming obese as a nation, and what are the factors responsible? Is fast food the only reason? I look forward to your audio and video comments on this issue and your posts on www.indiapostlive.com. Please send us your tweets, #IndiaPostLive and @IndiaPostLive, that's your handle. And the conversation of course will continue on the portal. But right now, to begin the conversation, I have with me in the studio Akshita Agarwal. Akshita Agarwal is a clinical nutritionist. Akshita, thank you so much for joining the conversation. She practices in East Delhi. I also have with me Sudeep Kohli. Sudeep Kohli is a writer and a blogger, and she is a mother as well. So I'm sure she will be giving us an entirely new perspective about the horrors she faces when her daughter probably wishes to have fast food. Also, we will be joined online by people, experts, nutritionists who will be talking to us. In fact, I can see Nidhi Tayal, another nutritionist, joining us on Google Hangout. Nidhi, hi, can you hear me?
Yes, Nilanjana, I can. Thank
Hi.
you very much.
Hi, thank you so much for joining the conversation. Let me first begin by asking Akshita. All right, now, do you think, you are a practicing, a nutritionist, do you see more and more children or young adults coming to you with problems related to obesity?
See, the trend that has become nowadays, I have numerous children who are coming to me with, problems that were unheard of in children. I have a patient, he's about 14 and he is having a high cholesterol problem. He has had and he has had a minor heart attack. The youngest child that I'm treating has glucose intolerance, that is the pre-stage for diabetes, and she's about 2.5 months old. So if I say that
2.5 months, I'm sure precludes this entire, the context of this conversation of
the fast food that has the habits that are changing. The fast food is not just consumed by the young. Okay, it is consumed by the parents as well.
Absolutely.
Now that the parents are obese, they are transmitting these obesity genes to the children. So though the child who is only 2.5 months old has nothing to do with it, but since he is born with those genes, he is suffering from this problem.
So you're saying, of course, obesity, in many cases, the hormones, and it is congenital. It could be congenital disease.
Yeah,
that's what you're
it
saying.
is hereditary, and it has been, proved in a number of researches that the children who are born out of obese parents do inherit obesity genes, and these children are at a higher risk of becoming an obese, becoming a diabetic or a hypertensive, as compared to those whose parents are comparatively leaner.
All right, let me quickly get Nidhi's reaction. Nidhi, what about your experiences as a dietitian?
Nilanjana, they are going to be similar as Akshita's. I get a lot of patients who are barely in the age range of 10 to 15 years are getting arthritis. The other day we were talking of vitamin D deficiencies,
Yes.
anemias, and of course, juvenile diabetes is definitely on the rise. And a lot of it has to do with the kind of food habits we are giving to our children these days.
All right. Let me now ask Sudeep, who is a mother herself. Do you face any issues with your own child? How old is your daughter?
She's 7. She's just turned 7. But
Does she crave or does she ask you for burgers and pizzas?
yeah, of course, and sweet is always a reward. When you come
Yes.
from school from a long day, you want a reward. When you've done your homework, you want a reward. So it's also things like that where it's really hard to say, you're not going to get that lollipop. Try that method is not going to work. But the problems that Akshita and
Nidhi.
the other Nidhi discussed. I think when we say children have these problems, and I completely agree with her. Children are not a separate species from us. Children are little big people. And who are these big people who are ingraining them with these habits? Who's giving them this food? Who's
Right.
giving them these guidelines? It's either in our homes or in our schools. So I think we have to take a lot of responsibility for for children going through the diseases that they are right now. Children are not feeding themselves; they're not cooking for themselves. It's us who is doing it, and for granted, the bigger people are the commercial advertisers who, through all the children's channels, take the power away from us. Every 5 minutes is an ad on a candy or in a sweetmeat or anything, and I see it, I want it. That's always their reaction. I want it, and they will remember it when they go to the market. That's exactly what I want, what I saw on TV. So yeah, that power is being taken away from us, and we have to somehow bring it back.
Akshita, what do you see? Because of course, when you have a burger, when you have a pizza, you are feeding yourself or your body with trans fats, with high levels of sodium, and arterial clogging, and diabetes, all these issues. How do you think there is a lack of awareness among the urban, we'll talk of urban or probably the SEC, ABC population, which does not really know what they're having?
See, I will not say that we are not aware. We are, but for the sake of convenience, we are ignoring it completely. See, if I'm a working mother, it is very convenient for me to go and ask my child to have a meal from outside. Because maybe I don't have time to cook, or maybe I'm too tired to do that. Plus, not only, it's just not me, who's asking the child to do it. See, I have come home from a very tiring day. I'll come home and I'll, just say, I am not in the mood to cook dinner today. So let's just all go out. So when the child sees that the parent themselves are stuffing with, themselves with a lot of fries and burgers, why would they feel that it is wrong? Because we ultimately follow our parents. So when the parent is feeling it is right, then why would the child feel that it's wrong?
All right, let me bring in Dr. Tejasimhan over here. Dr. Tejasimhan is a senior physician with the Arya Vedashala Kottakkal Research Center, and he's joining us through Skype. Dr. Tejasimhan, thank you so much for joining us on the conversation at India Post Live.
Thank you. Can you hear me?
Yes, I can hear you. The audio is not too clear, but I can hear you. Dr. Tejasimhan, you have been listening to the three ladies talk about, the concerns that, we are facing. And it is obviously, to a very large extent, the fault of the parents. But tell us your experiences when it comes to this issue of obesity and unhealthy children who come into you.
Yeah, definitely. I'm facing so many young children who are suffering from overweight and so many other hormonal disturbances like PCOD, so many other depression like things also. So all these are so many patients are coming.
Right.
Right, because of the side effects of this junk food. Junk food itself, it justifies its name. Junk means useless or extra.
Right. But
Isn't
Dr.
it?
Tejasimhan, I'm sure you agree that the children find it tasty. We all do. It's
Yeah,
comfort
because-
food for a lot of us. You know,
Yes.
at the end of a hard day's work, you
Yeah.
go into a McDonald's, you go into a KFC and you order a burger and you know, it's just tasty.
Yeah, it is a good palatable thing, and it is appealing to all the
Yes.
children as well as the adult people, no doubt about that, because it contains so much of calories, and it is devoid of minerals and vitamins and fiber, which
Right.
is necessary for our essential metabolism in the body.
Right.
So it will again leads to metabolic error in our body, leads to so many health problems. The Script Institute of USA has a study in 2008 that reveals that it alters the brain function in a manner of like cocaine and heroin.
All right.
And
This is new.
Again, you are
a few
craving
years
for
old, this study
the
now.
food, that food.
Yeah, 2008.
Oh.
Yeah, right. Okay. Okay. Let me bring in Sudeep again. You know, again like a mother herself. You know, obviously, I can imagine that it would be difficult for you to convince your daughter to probably have some Karela, you know, and easy for you to tell her, okay, here's some money, go grab a burger, right? How do you do that? How do you inculcate healthy eating in your child?
By being an example. I mean, as she said, I mean, how much fruit do we have lying in our refrigerators? What do we have lying in our cabinets? You know, if we have the quick fix snacks lying everywhere, that's what the child is going to go for, whether when you're home or not. But if you have a larger portion of fruits and you know, even if you've de-seeded the pomegranate and put it in the fridge ready, keep a lot of bananas, oranges, whatever, fruits, and even salads. Children, I mean, it's all about how children, I mean, how I've done it personally is at home, I don't keep any sodas. There is no Coke or Pepsi, no fruit juice or anything like that in my house. Desserts are only sort of ordered when we have guests over. So she knows it's only for, I mean, we consume that only when, I mean, for special occasions. It's not something we do every day. Of course, it's difficult. I'm like every other mother. I am fighting the battles of, you know, the candy world on TV and
Yes.
everywhere you look. But I really think at the end of the day, you know, kids are smart. You know, otherwise kids can pick up gadgets and kids can pick up every other thing. Kids can pick up the facts if you tell them what is good for them or not.
Let me bring in Simran Saini over here. Simran Saini is also a nutritionist who practices in Fortis. Simran, welcome to the conversation. Can you hear me? Simran, I cannot hear you. I think you can hear me, but I cannot hear you. Do you think you could unmute the mic? All right, we'll try and get Simran Saini back with us. Nidhi, I wanted to ask you very quickly, do you think, you know, of course, what Sudeep pointed out, you know, the kind of, by being an example, by keeping the right foods in the fridge, which her daughter has access to, but do you blame only unhealthy food habits for this problem that we've talked about? Do you think the fact that children don't really go out to play anymore, they are concentrating more on you know, video games and stuff like that, do you think that is also another issue?
Yeah, definitely. The crux of the problem is always going to be the food choices and lack of exercise, like you said. We as parents will have to encourage both. We just can't take it for granted that since they are exposed to the world of candies or McDonald's or video games and gadgets, we are the parents, we need to restrict the timings. Even if I have to hand over my iPad or tablets to the children, I need to give them those instructions to time themselves. Otherwise, children don't know what is right or wrong. It's we who are going to teach them. So definitely, as mothers, as parents, we need to encourage a lot of physical exercises and also encourage choice of right foods. And I agree to Sudeep in every which way. If you are hoarding your refrigerator and your kitchen with good food, healthy food, the options for a child to pick from junk food is going to be very, very limited.
All right, all right. Akshita, let me ask you, we seem to be going the US way, when it comes to issues of obesity, issues of unhealthy children. But at the same time, in that country, they have kind of realized the problem and they are trying to control it as much as possible. In fact, there have been certain movements like the slow food movement, where, it was started by a group of people where they encourage organic farming, organic produce, and they are trying to initiate and make people aware of the effects of fast food. How do you think India, especially Delhi, requires some kind of a movement like this at a much larger level, at your level, as nutritionists and as dietitians, to really curb this problem?
See, if you talk about just requirement, yes, I do feel it is required. But if we talk about, practicality, see, if I am recommending a patient and I ask him to take organic food, what problems do I face? They don't want to take it because of the affordability. The organic foods are not readily available. First of all, the availability is very less. If at all available, since the cost of producing them is so high, it is available at a very high price. So only a limited section of people are able to afford it. If we are talking about a movement, okay, we require a number of people who think alike and who want to join the cause. But it is only, certain people who will be having access to that. I cannot ask, people to fight for something they cannot afford. So first, if we are talking about this slow movement, see, you're talking about US, that we are following the disease pattern, like their disease pattern. But they have made these things available before starting the movement. So first thing that we need to see is whatever I am, educating people, I'm asking them to take, is it even available? Or am I just talking fancy? Right? So the first thing that we need to do is we need to educate people. Secondly, we also side by side need to manufacture things at a lower cost. If I am able to produce these things at an affordable cost, see, people don't want to consume brown rice because it is less palatable. Also, it is costlier than the common rice.
Yes.
Right? So a certain segment of people are not considering brown rice as an option because they feel ki why buy something which is not even tasty at a higher price.
All right. Okay, Dr. Teja Simhan, let me ask you, in your practice, when you talk to other practitioners in other cities, do you see Delhi as having a bigger problem when it comes to children's obesity? Because
definitely, because I have been in Delhi for last 5 years. So I have faced so many young children who are suffering from so many diseases which one see in our native place like Kerala and all. Because in Kerala this much of fast food culture is not there.
All right, please go on.
Yeah, fast food culture is not there, and in Kerala it is less. We see in our families, in friend circle and everywhere.
All right, all right.
And I would like to mention something about food habits also, because Ayurveda has considered as one of the tripod of our life as a food. The second one is our sleep.
Okay.
And the third one is celibacy. That is meant to married people and all. But anyway, this food is considered as one of the tripod of our life.
Yes.
So we should give prime importance to our food. You should take our food on time, and you should choose your food. Then only you will get proper nutrition as well as proper immunity.
See, again, there have been a lot of efforts that have been made in other countries when it comes to unhealthy food habits. I just talked of the slow food movement, which is, of course, discusses a much larger issue. You also have this publication called Eat This, Not That. Again, a US-based series which talks of the nutritional effects of every dish that you order in a restaurant. What do you think should be done in India where this problem is a very real problem and where children are suffering? I mean, she talked of a 14-year-old who has a heart problem.
No, we should start from our adult one, or when within the family itself, because when your parents are taking all these stuffs, how we can restrict our children. So we should be role model of our children, isn't it?
Mm-hmm.
First, start from ourselves. That we must stop all these juicy beverages and carbonated drinks, as well as pizza, burger, everything. First, adult one should stop. Then we can say it is not good for your health, not for your body. You should stop it.
All right.
Then we can educate our children. Otherwise, we are following the food at the same, and we are
Sudeep?
advising them to, avoid all this. They won't hear.
Okay, Sudeep wants to ask you something.
No, actually, I just wanted
Yeah,
to make a comment
definitely.
that I completely agree with him, because my daughter tells me that when I talk about fast food and you shouldn't eat this or you shouldn't eat that, she says, yeah, but big people do it too. They're eating this stuff. But I think we've enforced that point enough. But I'd like to go back to another point which he made, which was very significant, which is the kind of what fast food does to your brain. And what he talked about, the fact that fast food has the same effect on your brain that narcotics or alcohol or illegal drugs do. It's the same pleasure tolerance principle. It affects the same senses in the brain that illegal drugs like heroin does. So that is why when it comes to fast food, it's no longer the principle of it's just a calorie. It's any calorie, because it's not any calorie. A carrot or eating something fibrous will not do to your brain what it does when you are on fast food.
When you're on
It's
a diet,
cycle,
you have
it's
a
a
boiled
vicious
potato,
cycle.
right? A boiled potato.
Yeah, and you won't be able to eat excessively of a fibrous food.
Yes.
Try eating 6 bananas together, or try eating as many boiled vegetables or steamed vegetables. You won't be able to. Your body knows when to say no. But what happens with fast food is because there is no nutrition in it, and I think the body knows it's waiting. It's waiting for nutrition, so that tolerance level has lowered. So it keeps wanting more, waiting for it to get what it wants, but it doesn't. It becomes a vicious cycle.
Nidhi, is Simran there with us? Simran? Okay, I think we're still trying to get Simran Saini's audio. Nidhi, how do we really, fight this menace of the advertisers? Everybody is talking about the fact that the children and also the adults, they all get motivated to have the foods. They insist to their parents that they want to have the foods by looking at these advertisements on television.
The answer is playing with the psychology of the child. It's the same way like advertisers are playing. You need to counsel them, you need to educate them, you need to talk to them. The biggest problem is we are not giving quality time to our children these days. I am not only blaming working mothers. I have patients where stay-at-home mothers also tend to give a lot of junk food to kids, and I really don't know what are they doing with their time. So it's going to be a very psychological implication and the correct awareness. Like when you start talking to a bunch of women, especially mothers, and all they do is tend to quote words like diet soda. So they need to know what diet soda contains. Diet soda is not only you're not giving something which has which is lower in calories. It has a lot of other ingredients which causes problems, as mentioned by Sudeep. They are doing
Chemical cocktails is what they are.
Yes.
Yeah, because you're using sweeteners. They're very high on sodium. You're using sweeteners like aspartame, like Splenda, which are playing with your brain cells, which are wrecking your nervous system. So the correct awareness is very important, and then educating yourself and keep talking to your children is the answer.
All right.
I remember, when my son was barely 2 years old, I used to give him a date every day, two pieces of dates every day, wrapped in a nice shining paper. And for years he didn't know what candy is, because for him candy was a piece of date.
Right. All right. Let me again bring back Dr. Tejasimhan for his last comments. What Nidhi talked about, regarding, how parents play an important role. Give us your last comments, Dr. Tejasimhan.
Yeah, because I already told you the food has prime importance in our life. So some health tips which everybody can benefit.
All right.
With food habit.
How do you, Dr. Tejasimhan, I just want to ask you one question. When you have children coming to you with this problem, how do you treat them? Is because can this problem be reversed? Of course, it's a reversible problem. I would hope.
It is.
Yeah, it can be reversed, but only with changing the lifestyle.
All right.
Following good lifestyle means you have to do daily exercise as well as you have to skip all these stuffs.
All
and
right.
you have to skip on other beverages, all these. Then you must do a regular exercise as well as regular eating habits on time.
All right. All
We are
right.
changing our eating time every day. That also makes altered immune response in our body. That again leads to more susceptibility to illness as well as infection.
Okay,
Nowadays,
thank you, Dr. Tejasimhan. We have Simran Saini with us on the line. We have been able to connect her audio. Simran Saini, can you hear me?
Yes, I can hear you.
Great, great. Thank you so much. We are just about to wrap up the conversation, but good to have you on the conversation. Thank you so much. Your comments on this entire issue of the growing obesity, growing number of unhealthy young adults in India, especially in Delhi.
Yeah. Basically, as I have seen earlier, there was a particular age group that we used to get for obesity cases, let's say between 18 to 30 or 35 was the ratio. It was basically above 18, 4 years back. But now I have seen the age group has gone from, let's say, a 5-year-old kid, starting from 5-year-old kid until 60. So it's almost like all of us are exposed to this epidemic of obesity. Easy availability of food, easy availability of junk, I should say, is the basic cause.
Easy
And
availability, right.
Yes, easy availability is the foremost thing. Now pizzas get delivered right at your doorstep. Whether you leave the food for your child or not, you leave the money for him at the bedside and it's right at the doorstep that he gets the junk.
Right,
So
right.
that becomes the root cause. Now, the basic treatment itself lies with the parents again. See, the child is getting the supply of food and the money through the parents. So the grooming and the treatment has to be basically through the person at home, the parents or the guardians. They are the basic factors in the treatment of these kids.
All right.
In terms of obesity.
Simran,
Even
thank
in
you so
terms-
much. Yeah, thank you so much for your comments. Let me quickly go across to Akshita. Akshita, of course, what all of us really seem to agree on is that, this has to start with the parents, with the family and what you're doing, with the kind of food you're giving your child. But also, would you not agree that, over the generations, the quality of food itself, even when it comes to the basic vegetables, basic food grains, thanks to the pesticides and the fertilizers, even the quality of basic vegetables have also gone down, leading to a lot of problems?
See, this is a very, alarming issue, I would say. See, I get, people who are 75 years old or 70 years, they have better stamina than us.
Right.
So there is this patient I would especially like to quote. He is a 75-year-old and he comes from a distance of about like good 20 minutes walking. Okay. And if we have to, transit, so we would require a rickshaw to go.
Yes, yes.
So this is the kind of food that they've been consuming. It was pesticide free, or if not free, at least less pesticides were there. The quality of food was better. Their eating habits were better. There was no globalization and there was no fast food available per se. And the generation that is just before us is comparatively better to us, but lesser than them.
Let me get another perspective from Ria. Ria joins us through Skype, and I think Ria has a question to ask. Ria, welcome to the conversation. What is your question?
Hi.
Hi.
My question is that how do you expect children to have healthy food when parents nowadays are busy with their work and they probably leave the kid with having cold food and they think having a hot burger from KFC or McDonald's is much better than having the thanda ghar ka khana. So what would you
Thanda
say on
ghar ka
that?
khana. Okay, Ria, we in fact discussed this at the beginning of the conversation. Sudeep herself is a working woman and a mother. And Sudeep, would you like to respond to that?
I'm lucky I work from home, so I can supervise a lot more than mothers who work out of their homes. But I don't know what the ratio is. Maybe you would know better, Nilanjana, because we're a country where I'm sure malnourishment is a larger issue than obesity in India. But
But it is becoming an epidemic.
But in which strata of society? Because now, if it is in sort of the urban classes we were talking about, now a lot of us are lucky in India that we can afford good help, and now that we are lucky that good help can, feed us, warm food and we don't have to order out. And I mean, sometimes I think societies like the Western societies where, you know, labor unfortunately or how it is not so cheap. They don't have the luxury that we have of help in the house. So we shouldn't be having these obesity problems because all of us, I mean, have people at home who are taking care of the food for us. Even if we're not cooking for ourselves, we have people taking care of us for that and for our children. So I agree with the earlier nutritionist who said that even the mothers who are home,
Yes.
and when they have maybe 3 or 4 helpers at home to help them, why are their children having obesity problems?
So it's
then
lack of
comes-
awareness.
So it's a complete
I would
lack of
like to
awareness
answer this,
psychology.
Nilanjana.
Yes.
I would like to answer Ria's question.
Yeah.
Food habits are just part of education for a child. They are not a single subject per se. So like in other good habits when we are training our kids with, we can always use reward and punishment theory for inculcating good food habits as well.
Yes.
I would definitely like to propagate this point to the mothers present and
All
present
right.
here in the studio and seeing our show. If your
Yeah,
child
Sudeep
has
just
done
talked of
something
rewarding her child
you
with
are
sweets
to
when
the
she does
person.
homework. Sudeep just talked of rewarding her child with sweets when she does homework. So probably a relook on the reward and punishment issue. Akshita, last comments from you.
See, what I feel is that, like she said, ki, you know, the cold foods are there. So how do you expect the child to choose cold foods when the, you know, hot burgers and pizza served right, you know, at your place?
doorstep? Yeah.
See, the thing is ki, if we, you know, leave aside younger children, we are talking about adolescents here and young adults. I feel that little bit of cooking and little bit of, you know, reheating, even they can do. So they don't have to rely totally on the mothers, and you know the mother has to spoon feed her.
All right. So no excuses there for everyone, be it the parents and be it the young adults themselves. It is.
Also schools, sorry, but schools
Yes.
need to take responsibility of what
Yes.
they're serving the children in their schools.
in the canteens.
There is no excuse for serving them fast food when they can serve them. I mean, why not have fresh salads? Why not have
There are a
fruits
number
there?
of schools
Good
who
schools
have
are
come
starting
up
to do
with
it now.
nutritionists,
And it needs to
and they are planning food there.
Right. All right. So, okay, this conversation, of course, continues on IndiaPostLive.com through your audio and video comments, your posts. I think we had some perspectives that came out, but most importantly, the most important thing that came out was that no point in blaming the television ads, no point in blaming the radio ads, no point in blaming all those lovely pamphlets that come with your newspapers. You have to take charge of what your child is eating and of obviously what you are putting in your own body. The conversation continues. I would like to thank my guests who joined us through Skype and Google Hangout. Thank you so much, Nidhi, Simran, Dr. Simran, thank you so much. Of course, Akshita and Sudeep, thank you so much for joining me in the studio. Thanks for watching. Bye-bye.